Good morning, everyone. I'm here today to talk about something that many of you might be experiencing. Those dizzy spells and heart flutters that can be really scary. You're not alone, and there's a lot we can do to help you feel better. What are dizziness and palpitations? Let me start by explaining what's happening in your body. Dizziness is that feeling like the room is spinning or you might fall over. Palpitations are when your heart feels like it's racing, skipping beats, or fluttering like a butterfly in your chest. Think of your heart like a drum in a marching band. Normally it beats in a steady rhythm, boom, 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 but sometimes the drummer gets confused and starts beating too fast, too slow, or skips beats entirely. How these symptoms connect. Here's the important part. These two problems often go together. When your heart beats in an odd way, it can't pump blood properly to your brain. Your brain needs steady blood flow, just like a garden needs steady water. When the blood flow gets choppy, you feel dizzy or lightheaded. What causes this? As we get older, the electrical system in our heart can develop problems. It's like having old wiring in your house. Sometimes the signals don't travel the right way. This is very common and nothing you did wrong. When should you be concerned? You should always tell your doctor about dizziness and heart flutters. But call right away if you have chest pain with your symptoms, trouble breathing, fainting, symptoms that last more than a few minutes. Remember, these symptoms are treatable. The most important thing is that you're here learning about them, which means you can get the help you need. What is atrial fibrillation? Let me explain atrial fibrillation, or AFib as we call it. This is often the cause of those dizzy spells and heart flutters we talked about. Your heart has 4 rooms, like a house with 4 rooms. The top 2 rooms are called atria. Think of them as the entryways. In AFib, these top rooms start quivering instead of squeezing properly. It's like they're shaking instead of working together. Why does this happen? Imagine your heart's electrical system like the wiring in your home. Over time, some of the wires can get damaged or crossed. When this happens, the electrical signals get mixed up and travel in circles instead of in straight lines. This makes the top of your heart quiver rapidly, sometimes 300 to 600 times per minute. How AFib causes your symptoms. When the top rooms quiver instead of squeeze, they can't push blood down to the bottom rooms effectively. This means less blood gets pumped to your body and brain, causing dizziness. Your heart feels like it's fluttering or racing palpitations. You might feel tired or short of breath. Is AFib dangerous? AFib can be treated safely and effectively in elderly patients, but it does need attention. The main concerns are stroke risk. Blood can pool in the quivering chambers and form clots. Heart failure. Over time, the inefficient pumping can weaken your heart. Quality of life. The symptoms can make daily activities harder. The good news. Here's what I want you to remember. AFib is very treatable. We have excellent medicines and procedures that can help control your heart rhythm and protect you from complications. Many of my patients feel much better after treatment. Different types of AFib. Paroxysmal comes and goes on its own, like a visitor that leaves. Persistent stays until we treat it like a guest who overstays. Permanent. We focus on controlling the rate instead of the rhythm. Understanding which type you have helps us choose the best treatment for you. Great news about treatment. Here's something wonderful to know. We have many excellent ways to treat AFib, and patients tell us they feel so much better after treatment. Think of it like having a well-stocked toolbox. We'll find the perfect tool that works best for you and your lifestyle. Starting with gentle medicine options. We often begin with heart-friendly medicines that can gently slow down your heart rate to a comfortable rhythm, help your heart beat more regularly, keep you safe from blood clots with blood thinners. These medicines work beautifully for many patients, but if they don't give you the relief you deserve, we have some truly amazing procedures that can make you feel like yourself again. What is ablation? Your heart's reset button. Think of ablation as giving your heart a gentle reset, like restarting your computer when it's acting up. It's a procedure that carefully fixes the electrical signals in your heart so it can beat the way it was meant to. Remember those mixed up electrical wires we talked about? Ablation is like having the most skilled electrician in the world visit your heart and carefully fix those problem wires. The result? Your heart can beat smoothly and regularly again. The amazing process, simpler than you think. Here's the encouraging news about what happens. You'll be comfortably asleep under anesthesia, completely peaceful, no discomfort at all. Your doctor gently guides thin, flexible tubes catheters through a tiny opening in your groin. It's like threading a soft straw through a small hole. These tubes take a smooth journey through your blood vessels to reach your heart. Imagine a gentle boat ride through calm waterways. Using incredible technology and 3D mapping, your doctor can see exactly where the problem signals are coming from. The doctor then uses specialized energy to create tiny, precise repairs that stop the irregular signals. These small changes act like helpful roadblocks, guiding your heart's electricity back to its natural, healthy pattern. 3 wonderful types of ablation energy. Heat ablation, radiofrequency, uses gentle warming energy like a cozy heating pad, very precise and well tested over many years. Cold ablation, cryoablation, uses controlled cooling like a tiny targeted ice cube. Many patients find this very comfortable. Pulse field ablation, the exciting new option. This is the newest and most exciting development in heart rhythm treatment. Pulse field ablation uses electrical pulses to cause non-thermal, irreversible electroporation. But let me explain this in a way that will make you smile. Think of pulse field ablation like having a gentle, super smart electrical fairy that visits your heart. Instead of using heat or cold, it uses tiny, precise electrical pulses, kind of like very gentle static electricity shocks, but ones you can't feel because you're sleeping peacefully. What makes pulse field ablation so special? Incredibly precise. It's like having a surgeon with perfect aim who only affects the exact problem areas. Gentler on surrounding tissue, it may limit damage to tissues outside the myocardium. This means it's kinder to the healthy parts of your heart. Faster procedure. Many patients are done and recovering sooner. Excellent safety record. Studies show it's safe for treating patients with atrial fibrillation, with no significant difference in complication rates compared to younger patients, even in patients over 80 years old. How pulse field ablation works. The gentle magic. Imagine your heart's problem. Electrical signals are like weeds in a beautiful garden. Pulse field ablation sends gentle electrical pulses that are perfectly designed to convince only the problem heart cells to stop working, while leaving all the good, healthy cells completely untouched. It's like having a gardener who can remove only the weeds while making the flowers even healthier. The electrical pulses are delivered in microseconds, faster than a blink of an eye, and they're so smart, they know exactly which cells need to be changed and which ones to leave alone. Your bright journey to recovery. Before your procedure, you'll have some gentle tests to make sure everything is perfect for your treatment. Think of this as your medical team making sure you have everything you need for success. During your procedure, you'll sleep peacefully for 2-4 hours while your skilled medical team works their magic. Many patients tell us it feels like the most restful nap they've had in years. After your procedure, you'll have a comfortable day of rest in the hospital where nurses will take wonderful care of you. Then you'll gradually return to all the activities that bring you joy. Wonderful success stories. Here's something that will make you smile. Studies show that pulse field ablation is feasible and safe in patients over 80, with no significant difference in procedural outcomes and complication rates compared to younger patients. Many of our patients tell us they feel like they have a new lease on life after treatment. Less dizziness, fewer palpitations, and so much more energy to spend time with family and friends. Safety and peace of mind. Every procedure has considerations, but ablation procedures are remarkably safe when performed by experienced doctors who specialize in heart rhythm problems. Recent large studies have found pulsed field ablation to be safe and effective for treating patients with atrial fibrillation, giving both doctors and patients great confidence in this treatment. Questions that show you're taking great care of yourself. Am I a good candidate for ablation, and which type might work best for me? What will my recovery be like? And when can I get back to my favorite activities? How might I feel different after the procedure? What support will I have during my recovery? You're the star of your own health story. Here's the most important thing to remember. You have choices and you're in charge of your healthcare journey. Take all the time you need to think about what feels right for you. You can ask as many questions as you want, talk with family and friends, or even get a second opinion. We encourage all of that because it shows you're being wonderfully proactive about your health, your bright future. Your heart symptoms are very treatable, and with the right care, so many patients tell us they feel better than they have in years. You can look forward to getting back to all the things that make you happy, whether that's gardening, spending time with grandchildren, traveling, or simply enjoying peaceful nights of good sleep. Remember, taking this step to learn about your treatment options shows incredible strength and wisdom. You should feel proud of yourself for being so proactive about your health.